Well, hi everyone, it's 4 o'clock, so we're going to get started. Thanks for joining us tonight. We're here to talk about the Master of Healthcare Innovation, or the MHCI, which is an online degree program here at the University of Pennsylvania. Before we get started, I just wanted to review a few housekeeping items. There will be dedicated time for Q&A at the end of the session, but if you have a question that comes up as we're going along, feel free to type it in the chat box and either I or another staff member will read it out. I've also put up my email address, I'm Catherine, in the chat box. So if you want to contact me with questions outside of the session, you can contact me there. The session is being recorded, so we will send everybody a copy of the recording after the session. My name is Catherine Rodella. I'm the program manager for the Master of Healthcare Innovation, and that means that my job involves supporting students. I support them throughout their entire time in the program, from recruit, applicant, student, all the way through alum. I'm usually the first point of contact for applicants and students. Also presenting with me today is Adam Zolkover. He is the Associate Director for Online Instructional Design. And here's a peek at what we'll be talking about today. I'll be giving you a bird's eye view and overview of the program, including the program's mission and what the student body is like. I'll talk a bit about the in-person portion of the degree, the on-campus session. We'll take a look at the curriculum and what you'll be learning in the courses, tuition, what the online course experience is like, and Adam will actually walk you through one of the online classes briefly so you can see what one looks like. We'll hear from a couple of current students about their experience in the program so far, how to apply to the program. I'll mention a couple of certificate options. And again, at the end of the session, we'll have some dedicated Q&A time, but you can feel free to ask questions throughout by typing them in the chat box. The MHCI is a fully accredited master's degree program. It's designed to help you improve healthcare. The degree is housed in the Department of Medical Ethics and Health Policy, which is in the Perelman School of Medicine in the University of Pennsylvania. So at the end of the program, the degree is conferred by the Perelman School of Medicine at UPenn. Improving healthcare, the overall mission of the program, is something that clinicians, managers, executives, researchers, pretty much all health professionals need to know how to do. So the degree will prepare you to answer questions like, how do you shape health policy? How can you influence patient and provider behavior? How do you identify inefficiency in your workplace? How do you test solutions through rapid iteration? And these are topics that usually are not covered in medical school, nursing school, and business school. So this is really what sets the MHCI apart. I do want to mention one of the most important aspects of this degree is networking. The MHCI is definitely going to connect you to senior faculty members who are actively working in the field on a national and international levels. And you'll also get connected to your fellow students who are professionals from all across the healthcare system. Overall, the degree is meant to give you both the tools and the opportunities to start thinking in a more innovative way about the way that you do your current work and about the future of healthcare. So just like the field of innovation itself, the degree is a very interdisciplinary degree. We have faculty members from the School of Medicine, where the program resides. We also have teaching faculty from the Wharton Business School, Penn Law, the Penn Medicine Center for Healthcare Innovation, and Penn Nursing. And these faculty are going to teach you in 4 main topic areas in the degree. So these are health policy, which will help you understand the larger context of the healthcare system. Behavioral economics, which will help you influence decisions of patients, providers, and other stakeholders that you need to work with. Operations management, and of course, innovation methodologies. So how to operationalize your innovative ideas. Within those four main subject areas, you're going to be practicing specific skills in innovation and in leadership. And these you'll practice both in classes and in extracurricular activities. So those might include the in-person seminar and a speaker webinar series that we run. And this particular focus and combination on innovation and leadership is what distinguishes the MHCI from other degrees like, say, an MBA or an MHA. After the session, when you get the email with the recording of the session, you'll also get a PDF that lists out and explains in more detail the competencies of the program and the learning objectives. And I recommend that you really use this document to help you pitch the program to whoever you might need support from, whether it's a supervisor or coworkers, to help them understand what exactly you would be getting from the degree and what you'd be able to do after you have the degree. Any questions so far before I move on? Okay, sounds like we're good so far. So what will you actually be doing in the degree as a student? First and foremost, you're going to build a network of innovative healthcare professionals. This is a cohort-based program. So students go through the degree with a cohort who become their network and who they learn from. Students are professionals from a wide variety of different healthcare industries. So you're going to get exposure to a lot of different perspectives and a lot of different experience across healthcare, both the clinical and non-clinical side. There's a lot of relationship building in this program. We heard at the most recent graduation in May, one of our graduates said that he actually made more meaningful relationships in this degree than he did at his 4 years in undergrad. You're going to develop specialized skills for designing systemic solutions to problems in healthcare. So this is not a research-focused degree. You're going to be learning tools that you can immediately apply to improve the way that you do your job now and how you approach future roles. And finally, you're going to get a chance to apply concepts from the courses in practice-based innovation labs. So that by the end of the degree, you'll be able to implement an innovation project in the real world. Who are MHCI students? They are mid-career health professionals who have a shared goal of improving the way healthcare is delivered and fixing the healthcare system. Currently, we have 52 students across 2 cohorts. They have an average of 14 years of professional experience in healthcare, but there is a pretty big range there. Some of our early career students have maybe about 4 years of working in healthcare, and we also have students who've been working for over 30 years in the field. They come from all over the US, as well as from Japan, the United Arab Emirates, and Thailand. And they come from all different sectors, all different roles, and all different levels of the healthcare system. So you can see here some examples of the roles and sectors they come from. There are executives, physicians, entrepreneurs, administrators. They come from hospitals, pharma, insurance, government agencies, and more. And this is definitely not an exhaustive list of the kinds of backgrounds that a good potential candidate might have. Off the top of my head, I think somebody from dental medicine could also really benefit from the degree, and that's one that hasn't been represented yet. And just like their backgrounds are really diverse, our students come in with a lot of different goals of what they want to get out of the program. But those goals tend to fall into 3 main buckets. Some students are planning to stay in their current role, but they want to be able to do their work better where they are. Some have recently taken on a new role, or they know they're going to be taking on a new role, and they want to make sure that they get some new skills to be able to fill gaps so they can be successful in that role. And some students are aspiring to a more leadership position in the future, and they hope that this degree is going to help them get there. Any questions so far? Again, if you have a question, you can type it in the chat box. Okay, great. Let's keep going. This is an online degree that has a one in-person session each year. It's 4 to 5 days every August here on campus in Philadelphia. The next one is scheduled for August 21st through 25th. And the in-person session really is an essential piece of the program. This is where you're going to meet your fellow students, you'll meet the faculty and staff, and you'll start to really build those connections. It's a pretty jam-packed but very fun week. You'll take part in interactive workshops. For example, we've had ones on negotiation and public speaking. You'll attend networking events. You'll hear presentations and panels from faculty members and outside experts. And for new students, there are orientation sessions. Lodging is provided for students. Most meals throughout the week and the activities are all covered by the program. So the only additional cost to students is their travel to and from Philadelphia. And again, this week is intense, but it is really fun. Everyone gets to know each other very well in a short amount of time and starts to make great friendships and professional connections. This is a bird's eye view of the curriculum. Typically, the degree is earned in 20 months. Each cohort always starts in August, and then their coursework would conclude in May of their second year. This schematic specifically shows how the coursework is laid out for the 20-month track, but there is also a 3-year option for anybody who might need to spread out the time commitment or the financial commitment over a little bit longer period of time. On the 3-year track, you're taking the same exact classes, you have the same degree requirements, but you're spreading it out a bit more. Essentially, this year 1 you see here would be spread out over 2 years, and the final year would probably remain mostly the same as it's listed here. Like I mentioned in the last slide, each school year first kicks off with 4 to 5 days on campus at the Healthcare Innovation Seminar. And then for the rest of the school year, students are working, taking their online classes remotely. The courses that you see in blue are the core courses. You'll notice some of the topics that I mentioned as the main topics of the program: healthcare operations, behavioral economics. These courses are all 6 weeks long, and they're taken one at a time so that you can really focus on the topic at hand. Usually in the 20-month curriculum, usually there's 1 week off in between these 6-month courses so that you can catch up on things outside of school. There are 4 lab courses. Those are the courses you see in yellow. They each are associated with a particular core course, and in the lab course, you practice applying concepts learned in the core course. Lab courses are 4 weeks long. You'll notice with the first 2 labs, operations management and behavioral economics, there is a little bit of overlap between the core course and the lab, but otherwise, there's a break in between all of the courses. And then finally, there are 2 electives. Electives are 6 weeks long each, just like the core courses. And students can choose from a preset selection of courses to pick courses that reflect their own interests and goals. Now, in one of these 6-week-long classes, students are spending typically 13 to 15 hours per week working on schoolwork, to give you an idea of that time commitment and rhythm. So it would be usually 6 weeks on, 1 week off, and that's how the rhythm of the year would go. In lab courses, you'll get an opportunity to apply concepts, practice applying concepts from the core courses. In the first 2 lab courses, you're learning skills to get your ideas out into the world. So to give you an idea of the kinds of activities you would do, For example, in the behavioral economics lab, you're given a case study to analyze, and then you're asked to write a proposal for a behavioral economics intervention. So it's usually project-based assignments in these labs. In the final 2 labs of the program, which are always taken in the very last semester of the degree, you're drawing from your own work experience to develop a project proposal. So you are writing and fully developing this proposal so that it's in hand and ready to be implemented as soon as you're done with the degree. Students do get the opportunity to choose 2 elective courses. Elective offerings can change from year to year. These are the list of topics that were available this year to give you a sense of the kinds of topics that might be available. Any questions so far about the curriculum and the courses? Okay, sounds like everybody's good so far. Oh, Linda has raised her hand. Hi, Linda, did you want to ask a question? You're unmuted. Oh, that's okay.
Hear me now. Yeah, the question was for the projects, are they team-based or individual, or is it mixed?
Usually individual, though sometimes you might be asked to provide feedback on another student's project or draft.
Great, thank you.
No problem. I have another question from the chat. Is this degree appropriate for someone who does not have a 4-year degree in the medical field, but who has worked in a medical setting as a counselor and political advocate? I would say yes, you don't have to have a medicine-specific degree in order to do this program. The eligibility requirement is that you need to have at least 3 years of professional experience in some sort of healthcare setting or sector, or in a closely related field, even if it's not specifically in medicine. If you can make a strong case for being able to apply your experience to this degree and to be able to be in a position to improve healthcare after the degree, that you're welcome to apply. Another question from the chat, what percentage of students in the 20-month program are also working full-time? 100%, all of our students in the program are working full-time, no matter which track they're in. Students are charged tuition on a per credit basis. So as they register for courses each semester, depending on however many credits they registered for, that's how they'll get billed. The way that Penn counts course credits is they use something called course units. So one course unit is roughly equivalent to a typical semester-long course, what other colleges might call a 3-credit course. So in the MHCI, core courses are 1 CU, 1 course unit, electives are 1 CU, and lab courses are a half CU. So total throughout the degree, students have to take 11 CUs. In the upcoming academic year, 1 CU for tuition and fees will cost $5,709. So that puts the total degree somewhere in the ballpark of $63,000, and rates might change slightly from year to year. You can see in the table on the right how the CUs are distributed among each semester in the 20-month program. They're distributed pretty evenly, so you can expect to be paying in pretty even chunks throughout the degree. On the extended track, there are lots of different ways you could configure your schedule. So the number of CUs per semester varies, but it'll always be somewhere between 1 to 2.5 CUs per semester on that 3-year track. So students pay for the degree in a few different ways. Some of them are self-funded. Some students are able to get some sort of tuition assistance from their employers, and some students opt to pursue loans. I did want to make a note, if you're considering looking into federal loans as an option, they do require you to be enrolled in at least 2 CUs per semester. So if you're on the 20-month track, you can see that you'll be eligible, you'll hit that minimum in every semester. On the 3-year track, since it's more spread out, you will be taking fewer than 2 CUs in most semesters, so would not be eligible for federal loans in a lot of those semesters. So just something to keep in mind if you're thinking about federal aid. I've had a couple of questions come in. Is a standardized test score required to apply? No, you don't have to send in any, GRE or GMAT scores in order to apply. Can you discuss the nature of the faculty, their work and academic backgrounds? Sure, a lot of our faculty are based here in the Department of Medical Ethics and Health Policy. One of our core and founding faculty members is Zeke Emanuel, who is very active in health policy on the national scale. Kevin Volp is a well-known expert in behavioral economics. We also have Christian Turvich, who is from the Wharton School. He teaches healthcare operations. And Amal Navate, it teaches evaluating health policy and programs. He's a health policy researcher here in the department. And again, we have a very multidisciplinary faculty. Some come from Penn Law. The dean of the law school teaches one of our elective courses. We have faculty from Penn Nursing and from the Penn Medicine Center for Healthcare Innovation. Another question from the chat, does Penn offer tuition assistance to their employees? Yes, it does. The exact amount depends a lot on your individual situation, so your employment status and how many classes you're taking. So for any Penn employees, I'm happy to talk to you individually outside the session to help you estimate what you could be expecting to get in your tuition benefits. So all of the courses in the program are online. They're administered on a platform called Canvas, which some of you might already be familiar with, some of you might not be, and that's okay. If you've ever used Blackboard, it's a very similar platform to that. So to access your courses, say if you were going to, sign on and watch some videos or work on an assignment, you would simply log on to Canvas and you'll see links for all of the courses you're enrolled in. You can click into your course and all of the content for that course will be available in one place. Like I mentioned before, you can expect to spend about 13 to 15 hours per week working on a course while you're in a course. They're usually 6 weeks long for core and elective courses or 4 weeks long for a lab. And you'll come to find there's a pretty steady rhythm, weekly rhythm to the courses. Every week you'll have some content and media to look at. So there are brief lecture videos. These are 8 to 10 minute engaging pre-recorded videos by the faculty members. There are usually readings to provide context and give you some additional resources. Every week there are interactive activities, so you'll be interacting with other students, responding to posts that they've made. Every week there's some sort of interactive session with the faculty member. That can happen in a few different formats. One common format that you'll see a lot is a weekly sync class. So that's a 1-hour video conferencing session led by the faculty member. It's live and scheduled at a specific time. So for sync classes, you will have that schedule before the course starts. You'll know ahead of time when to expect them, but they're also recorded. All of our students are working full time and live in all different time zones. So inevitably, you might have a conflict or not be able to make every single sync class, and that's okay. That's why the recording is there for you to watch. And finally, there are assessments. You might have a quiz to take, you might have a homework assignment to work on, and every class has a final project or paper. Most of the assignments are due on Sundays and Tuesdays, so you have the weekend to work on them. So next I want to hand it over to Adam, who is going to show you what one of the classes actually looks like in Canvas.
Hi, I'm Adam. I am just going to get my screen on for you. I am the Associate Director for Online Instructional Design, as I think Catherine said at the top. And while we're looking at this course, there's basically 3 takeaways that I'd like you to get. That our courses are social in that there's a lot of interaction. There's interaction with the faculty, there's interaction with your peers, there's interaction with the TAs. The courses are predictable. As Catherine said, most of our courses are 6 weeks. Most of the work happens on a schedule. You know when you're going to turn in your work. And our courses are supported, which means that there's always help available, both technical help and help with the content. So what I'm showing you right now, I hope that, that you can all see it, is the front page of the first course that you'll be taking, the American Healthcare System with Dr. Emanuel. All of our courses have a lot of information up front, so you know what you're getting. This one, you can see the course title, you can see contacts for the TAs, you can see contacts for technical support, how to download a syllabus. If you go further down the page, there's a detailed course overview, including a clear outline of what you should expect to get from the class. And further down the page still, you can see all of the topics and key dates outlined for you so that you can put them in your calendar on day 1 of the course. Now, really what I want to show you, maybe the most important part of the front page, is at the very bottom. It is this red Start Here button. When you click on the red Start Here button, what it takes you to is all of the content of the course. Our courses are chunked into weekly modules. Every course starts with a help module so that you can come back to and get information if something goes wrong or if you're not understanding something about the technical side of the course. But the weekly modules each contain basically 3 things. They contain videos, they contain readings, and they contain activities. Those are interactive activities and less interactive activities where you're doing some research on your own. So I want to show you an example of the videos. And I think that that will be really helpful. I'm not going to play one for you because it's hard to play them over video. A lot of people have a bad experience when you're doing it on a video conference. But I wanted to show you what our video pages look like. Every page has the video itself, which is a short lecture on a very specific topic. So this one's about accountable care organizations, for example. If you go down the page, most pages have supplementary material. That includes links out to more information. So this one has information about ACOs from the Center for Medicare and Medicaid Innovation. But most of them also have PDF handouts. A PDF handout is a short 1-page takeaway from a course that you can download, you can review it, you can show it to your friends, you can bring it to work. It sort of helps you take this knowledge and do something with it. The last thing that I wanted to show you here is the support links. Every page has links to getting help with Canvas and has links to our help email. There's always somebody who will get back to you within a day or so. The last thing that I wanted to show you is course discussions. Course discussions are the main thrust of the work that you're going to do in the class. Each week, usually on Sundays, you're asked to make 1 post, and then you're asked to reply to 2 posts from your peers. These discussions all tie into the lectures and the readings for every week, and these discussions are also the social part. They're going to be where you're going to get to know your classmates, get to know the way that they think, get to know the way that they work. And people say that they form really strong bonds, sort of working relationships based on the responses here. So that is our courses in a nutshell. With that, I'm going to hand it back to Catherine.
All right, thanks, Adam. Let me just pull up the presentation again. There we go. So there are a few things that I wanted to reiterate about learning online. First, keep in mind these classes are designed specifically for healthcare professionals who are working full-time and learning remotely. So there is flexibility built in. Our students have all kinds of crazy and demanding schedules. They live in all different time zones. So we're very used to working with our students to make sure that the classes can work for them. The content is all available on demand within course dates, so you can sign in whenever your schedule allows to work on your assignments. And you'll have a week off on the 20-month track between courses to pause and take a break, and usually longer breaks than that on the 3-year track. And again, like Adam said, there is a lot of support. Even though you might be working remotely, there's a team of actual humans here behind the courses supporting you. At the on-campus seminar, you'll have a technology orientation, so you'll learn exactly how to access the courses and how to navigate them before you ever even have to take one. There's a student website with tips and video tutorials about how to navigate Canvas and tips for how to succeed in an online course. You can get coursework help from our teaching assistants and course coordinator, who are really an essential part of the course delivery team. Of course, there's administrative support from myself. I'm always a phone call away or an email away. And we also have our own in-house technical support that you can email if you're running into any trouble. I had one question from the chat: what are requirements for enrollment? I'll get into that in more detail when I talk about admissions, but the 2 minimum requirements are: you need to have a bachelor's degree. Again, it doesn't have to be in a medical specific field, but you do need a bachelor's degree, and you have to have at least 3 years of professional experience in healthcare. So I'm very excited to welcome 2 of our current students on the call who are nice enough to share some of their very limited free time with us today. Bruce Brode is a dermatologist here at the University of Pennsylvania. He's in his final year of the program, so will be graduating this May. And Alyssa LaGuardia is a project leader at New York Presbyterian. She's a relatively new student in her first year and just started this past August. So Bruce and Alyssa, I've unmuted both of you. Would you mind just briefly introducing yourselves, and then I'll have a few questions for you. Bruce, do you want to start?
Oh, yes. Hi, everybody. And thank you, Catherine and Adam, for doing such a great job, providing such a great overview of the program. I think you gave a very accurate and clear depiction. So I'm a dermatologist. I'm on the dermatology faculty at Penn Medicine. And then since I've started the program, I'm taking on a new role as section chief in dermatology at Pennsylvania Hospital. When Catherine was talking about sort of the range of students in terms of years of experience, I think I throw off the average length of time in healthcare a little bit, because I've been in practice for 29 years. So I probably skew it upwards a little bit. And the program's been terrific. I'm also heavily involved in shaping health policy, mostly by working with organized medicine, and I've I hold some leadership positions within organized medicine as well.
Thanks. Alyssa, you want to introduce yourself? Hey, Alyssa, are you there? Looks like Alyssa might be having some trouble with her audio. So Bruce, if that's okay, I'll just go ahead and start asking you a couple of questions about your experience in the program, and hopefully Alyssa can join us in a minute or two.
Sure.
So Bruce, why did you decide initially to pursue the MHCI?
No, that's a really good question. I think, you know, as I said, I've been on the derm faculty and been involved in organized medicine. I think I reached a point in my career where I realized a lot of my learning was experiential in nature, and I really didn't have a lot of formalized structure to my approach to things, and I wanted to take my career to the next level. I wanted to be able to carve out a niche within my field, develop some skills and tools where I could lead change. And I think for me, and I think this reigns true for a lot of my cohorts, I wanted to have better tools in the toolbox to be able to make a difference. I think, the course content, but I think more importantly, the faculty is really what sold me on the program, and I think I've not been disappointed at all. I think my expectations have been both met and far exceeded. I'll tell you a story. Not that I want Dr. Emanuel to have calls from everybody, but I really feel like I have to share this story. When I entered the program, and I entered in the second year, it's still a very young program. And so I think, which is kind of neat, because I think there's a lot of opportunity for the cohorts to shape the program going forward, and I think our voice is heard. But Dr. Emanuel, it was a new program. I wanted to learn about it. I reached out to Dr. Emanuel through the administration. He actually took the time to call me directly. He's a busy person who's got his hands in lots of irons, but he called me from overseas in response to my questions about the program. And I think a big question that probably applies to a lot of you is, how's this going to impact my career? And I posed this to Dr. Emanuel, and the short answer, this was a few years ago, and I'll paraphrase, was really the goal of the program was to create leaders. And that while he quite honestly didn't say, if you do the program, you will do this, what he pointed out was that I would have the opportunity to gain unique skills, and that those skills, it's really what you put into it is what you get out of it. But those skills could have the potential to set me apart from others in my field. And I think that's reigned true.
Great, thanks. I'm going to, hey, Alyssa, were you able to figure out the audio?
Can you hear me?
I can hear you kind of quietly. Are you able to turn up the volume at all? Or maybe bring the mic closer?
Is this any better?
Yeah, that's a bit better, thanks.
Great, I'm sorry about that.
Oh, that's okay.
Hi everyone, my name is Alyssa LaGuardia. I work at New York Presbyterian Hospital in New York City. Just to echo kind of what Bruce has said, I come from healthcare at a different perspective. So I recently graduated college. I've been in healthcare for about 5 years now, and working on more of the business and finance part of healthcare. I've had such an interesting experience thus far in the program, working with people from all different walks of healthcare who have really given me an interesting perspective. And the program's been so well organized, and just, networking with people, whether they're physicians or working in different startups. It's been a great experience just in my first semester. So I can echo a lot of what Bruce said.
Great, thanks. This is a question for both of you, so why don't I start with Bruce? Can you talk a little bit, or do you have any examples of how the program has impacted your work so far?
Oh yeah, no, sure. That's a great question. I think it's impacted my work right off the bat. So I think one of the neat things about this program is the skills that we learn are really immediately applicable. I would say every dimension of what I do at work, life in general, has been impacted by the program. So I'm working on a project now to improve the efficiency and the type of testing I perform to help my patients. I specialize in people with allergic reactions of the skin, and the program has given me skills which I would have had no starting point prior to this program, but now I have skills to understand how to approach this problem and design an innovation and test the innovation. I think initially I learned about I gained a better understanding of the complex interplay in our healthcare system. For me, that was really important because I do work in health policy, and I gained a better understanding of every aspect from providers to payers to patients. And it's helped me in my work with health policy to interface with a lot more knowledge with every aspect. I feel like I can speak the language. And I think in a general sense, it's provided me with just structure to allow me to think more critically about every aspect of my life.
That's great. Thanks. Alyssa, anything you wanted to add about how the program's impacted your work?
Yes, definitely. I think I just came out of a healthcare operations class, and I've actually been able to apply that in work. So I've been able to get more involved in the operations of the hospital where I work. Just, you know, from talking to people, oh, this is what I'm learning about in school, and they're like, let me get you involved in this project. So I'm really able to use what I'm learning and also apply it to work at the same time. So I think that's a really interesting concept and also beneficial in terms of career advancement as well. I've been able to get exposed to different parts of my organization that I normally wouldn't, and kind of helping me shape, you know, what do I want to get into as I grow my career and what do I find interesting. So everything that we've been learning has really been applicable and been really relevant. So I can really appreciate that part of it.
Thanks. So in the interest of time, I'm going to move on just to make sure we have plenty of time for Q&A at the end. But Bruce and Alyssa, thanks so much for sharing your experience. And if you wouldn't mind staying on to the end in case anybody does have questions for you later, that would be great. Right, so if after all of this you think the program sounds great and sounds like a good fit for you, the next step is to apply. There's an early application deadline coming up on February 14th, though the final deadline is May 1st. You can apply before either deadline in order to start in August, but the advantage of applying earlier is that you would get your decision earlier. It's not rolling admissions. The admissions committee is going to review each application pool after the deadline. So if you apply by February 14th, you can expect to hear back sometime in March. I know we had some questions about eligibility earlier. You, in order to apply, you need to have a bachelor's degree and you need to have at least 3 years of professional experience in healthcare or in a closely related field. If your experience is not in healthcare directly, but in a related field, I would advise you to really make a strong, clear case in your personal statement about how your experience applies and what you would do with a degree. So to apply, there's an online application. You can find it on our website, which is improvinghealthcare.net. It's under Master of Healthcare Innovation and Admissions. So there's an online form to fill out. In the online form, you'll be asked to upload a personal statement about why you want to do the degree, how you would apply it, and I advise you be as specific as possible. It really will make your case stronger. You'll also be asked to upload a current resume and to provide contact information for 2 recommenders to write letters for you. And just so you're aware, when you put in the contact information for your recommenders, the application system is going to automatically send them an email asking them to upload their letter. So you might want to give them a heads up ahead of time so that they expect that email when it comes and they know what it is. Outside of the online application, you'll also need to send us official transcripts from your previous schools. These should be sent directly from the schools, either electronic or hard copy is both fine. And you can find the contact information of where to send those on the application page. There's no application fee, and again, we don't require any standardized test scores in order to apply. One more thing before we get to your questions, I did want to mention that the department offers a couple of certificate options if you think that committing to a master's program is not the right fit for you. There's a professional development certificate, which is a non-credit certificate. If you take 4 of those courses in a year, you can earn that certificate. Those are 4-week online courses. And then there's also an academic certificate. Within the academic certificate, you are taking master's level courses from the MHCI. If you take 4 of those within a 2-year period, you can earn that academic certificate. And in the academic certificate, because those are credit-bearing courses, those credits can be transferred into the master's program if you end up applying and are accepted to the program. So if you're interested in learning more about the certificates, you can find more at our website, which again is improvinghealthcare.net, or feel free to email me or call me outside of the session, and I'm happy to talk to you more about those. So that's the end of the prepared presentation. Again, there is an early application deadline coming up on February 14th. You can find the application on improvinghealthcare.net. Once you go into the application, it'll ask you either to sign up to create an account, or if you've created one before, to sign in. And if you have any other questions that are maybe more individual to you that you want to ask me on a one-on-one basis, I'm happy to field all those questions. So you can contact me at the email address on the screen here. For anyone who's maybe listening in on the phone, it's mehp.online@pennmedicine.upenn.edu, or you can call me at 215-573-9378. So thanks everybody for taking the time tonight. This is your time now until 5 o'clock. If you have any questions, I'm happy to answer them. Again, you can type them in the chat, or if you want to speak up and you have a microphone, feel free to raise your hand and I'll unmute you. We have a question: when are recommendation letters due for the February 14th deadline? They're due, it's the same deadline as the application. They're due by February 14th. If there's some sort of circumstance where you think your recommender is going to have trouble getting it in, then and we'll need to send it a day or two later, please talk to me and let me know, and maybe we can work out an exception. Okay, I see Marquis raise her hand. I've unmuted you, Marquis, if you want to go ahead and ask your question. Okay, maybe not. Anybody else with questions? When is the first payment required? So students are billed as they register for courses. So typically they register at the beginning, or actually towards the end of the previous semester. So for example, you would probably be registering in August for the fall semester, and then would get a bill either in late summer or early fall for your first bill. It depends exactly on what date you registered. The billing office sends bills out automatically on a monthly basis. If I need my employer support, can I have a letter of approved? Sure, yeah, anyone who's accepted into the program and accepts our offer of admission, if they're getting financial support from your employer, we can definitely provide you with a letter if that's what you need to fulfill the employer's requirements. What does the process look like for transferring credits from the certificate program to the master's program? So if somebody is in that academic certificate that I mentioned, the one that with credit-bearing courses, you can transfer credits into the master's program. You would need to apply to the master's program through the usual avenues, and then if you're accepted, the transferring is really just something that happens administratively on the back end. So I would work with the student individually, and we'd make that happen. Are many universities adopting this master's program, or is this unique to Penn? A little bit of both. This is pretty unique to Penn, although over the past couple of years, we're starting to see a few more innovation-focused master's degrees pop up. I would say one of our maybe cousin programs that seems the most similar in content is a Master of Science or a Master of Healthcare Delivery Science from Dartmouth. It's not quite the same topics in the curriculum, but we're starting to see more degrees focused around you know, problem solving in healthcare. Do you need transcripts from college and medical school, or is college sufficient? A good rule of thumb, if you got a degree from the school, we'd like to see that transcript, or if you've done maybe a significant amount of coursework from that school, we'd like to see that transcript. If it's, you know, say you took just one course at one summer course at a local school, we don't necessarily need that transcript unless for some reason you wanted to make sure the admissions committee saw that you took that course. Is TOEFL needed? No, we don't require any standardized tests like that, but we do ask that applicants who are not from the US should demonstrate a really solid grasp of English, both in speaking and writing. Students who, or applicants who make it past the screening stage will do a virtual interview with me, so we'll have a conversation and engage it that way. If you completed undergrad at Penn, do we still need to send in the transcript for Penn? Yes, you do. So any programs who already have your transcripts, it's not automatically shared across schools and programs for privacy reasons, so you would still need to request the transcript. Is there any advantage to applying early decision? The advantage is that you would get your decision sooner. You would get the decision in March and be able to better prepare for the upcoming school year. We do tend to get a lot more applications for the May deadline, so you might also be compared against fewer other applicants than you would if you applied for the May pool. So one common question that I get a lot from potential applicants is, what's the difference between the MHCI and other degrees that you see, like say an MBA or a Master of Health Administration or an MPH? I think something that's unique about the MHCI is that it's about contextualizing your role in the larger healthcare system. So you're going to be thinking about things like, how do we improve the experience of patients, doctors, payers, administrators, which you won't necessarily be focusing on it on other degrees. An MBA would probably be a little bit broader and not necessarily specific to healthcare. An MBA would definitely be more managed focused, management focused. You might have more courses on things like finance and marketing, which is not something that you're going to be working on in the MHCI. More business management fundamentals in an MBA. An MHA also would include more finance and management related courses. Most students in an MHA are going into administration or already in administration, whereas in the MHCI, you're going to see a much more diverse mix of professional experience among students at all levels, not just at the administration or management level. And an MPH, there might be some overlap in policy, but MPH would have epidemiology, environmental health, occupational health. It might be a little bit more research oriented as well, which the MHCI is not. The MHCI is more meant to give you skills that you're going to immediately put into practice. So is there a cap on cohort size? No, there's no set cap. As long as we think that the candidate is strong and is going to have potential to influence healthcare and looks like that they can handle the rigor of the program, we wouldn't keep somebody from joining the program. If you already applied to the program previously, do you still need to resubmit your transcript? We should still have that on file. So if you applied previously, just send me an email outside of the session and double check with me that we have everything to make sure nothing is missed. If accepted, can we audit some of the recorded courses prior to orientation in August? Probably not. Generally, the courses are still being built. The course sites usually open a few days before the course starts, although there are some video lecture excerpts that we definitely can send to you if you want to get a sense of what the lectures will be like.
Hey, Catherine, do you mind if I add on to that?
Sure, go ahead.
Great, this is Adam. I just wanted to add on to that, though you could watch the video lectures, watching them out of context, not in the class, might not help you as much as you think. A lot of the experience of the class is that social element. It's working through the material with your peers in the course.
Yeah, thanks, Adam. Good point. If rejected in early decision, can you apply in full decision? So I want to make the distinction that our two deadlines, it's not early decision that way. One is an earlier deadline. Either way, if you get a rejection, you would have to reapply the following year. Does any of the coursework contain methods and techniques to innovation? Yes, definitely. Some of the courses that the second cohort is taking this year definitely cover that. So translating ideas into outcomes is one where you're going to be learning specific innovation methodologies. So how do you operationalize ideas that you have for, say, an innovative program or policy in evaluating health policies and programs. You learn how to evaluate new programs that you maybe are going to implement. So it's definitely very methods and skills-based innovation topics in these classes. Is there continued career counseling as you go throughout the program? So the program definitely offers some informal career help. There's not individual one-on-one career coaching or career placement services. The biggest piece of what the program is going to be able to do is connect you to a network. So through all of your students who are amazing professionals from all over healthcare, the alumni, the faculty, guest experts, all these people that you'll meet throughout the program are going to be a big part of creating your network and connecting you to new opportunities. The program can help you help prepare you to develop your own career path, but is not set up to provide that sort of one-on-one career mentoring. There are a lot of activities that the program does, however, related to career help. So at the in-person seminar, for example, there's networking events. There's a networking reception with health employers. There are always some career-focused sessions. So for example, this past year, there was a career coach who gave a presentation and talked to students. We also had a presenter from a executive recruiting firm who talked about trends of hiring in healthcare and what those kinds of firms are looking for and how you can make yourself more attractive to those types of firms. Our alumni ambassadors can provide a lot of guidance. Often some of our alumni volunteer to provide shadowing opportunities for students. All students will get access to Handshake, which is a virtual recruiting platform and job search platform that Penn offers. And we also do a monthly webinar speaker series on different skill sets, and that'll help connect you with more experts and organizations. With healthcare changing so quickly, do you feel that a lot of the information provided throughout the course will remain relevant in 5, 10, or 15 years? We give all of our courses a 3-year limit on shelf life. Every 3 years, a course is completely redone to make sure it's up to date. And then if there are any major changes or developments within that 3 years, we will make those changes in the course on the fly. So if a lecture needs to be re-recorded or readings need to be updated or anything like that, the courses are fairly agile in that way. Did I cover that, Adam? Anything else you'd want to add?
Yeah, the only thing that I would add is that you see the video content updated, as you said, maybe large updates every 3 years and more granular updates as the landscape changes. The other thing that I would add is that there's a lot that is generalizable in these courses. So you will get information that's really specific, like the state of 1115 Medicaid waivers comes up in the American healthcare system, but you'll also get a lot that is on the more timeless side. Like, for example, core concepts of healthcare operations are applicable. Professor Turvich would say that they're applicable anywhere in healthcare at any point, but he would also say that they're applicable in other fields, and that what they're doing, what you're doing in that course, is specifying for your professional setting.
Great. So it's 5 o'clock, so I want to thank especially Alyssa and Bruce for taking time to be here and share their experience. Thanks, Adam. Also, and thanks all of you for attending and for all of your great questions. If you had a question that we weren't able to get to in the session, please feel free to email me. I'm happy to chat with you more about the program. I've just put my email up again in the chat. And thanks, everybody. Have a great night.